Well, good day to everyone. The Global Nutrition Cluster is happy to welcome you to this webinar, Applying the Gender Transformative Framework for Nutrition, Practical Insights and Tools. This webinar will be recorded so that we can share the recording with anyone else who is not able to attend, and the recording is already in process. We do have simultaneous interpretation available for you today. We appreciate Rashid Ntugi providing Arabic interpretation and Alexandra Alvieres providing the French, both with the Cepratec agency. Please click on the globe icon at the bottom of your screen to access the interpretation. You may need to click on the 3 dots to locate that globe icon. While our colleagues join us, please take a moment to introduce yourself in the chat with your name, your organization, and let us know where you're listening in from. We're thankful to the support of the Global Nutrition Cluster donors, without whom we would not be able to deliver this webinar. And we're also deeply thankful for all of the active participants of the GNC working groups who work so hard in the nutrition and emergency space. I'm now going to hand over to Miriam Chang to take us forward. Miriam?
Thank you very much, Miriam. I am just taking a second to make sure my camera comes back on. Good. Hello, welcome everybody. Thank you so much for taking time to be with us today. My name is Miriam Chang. I work for World Vision Canada. And together with Action Against Hunger, 𝗵𝗹𝗶𝗀𝗇 Health Research Institute, CARE Canada, Health Bridge, Nutrition International, Save the Children Canada, we joined forces back in 2020 to form the Gender Transformative Nutrition Framework for Nutrition Coalition back in 2020, because we are a group of organizations committed to advancing nutrition and gender equality. So the Gender Transformative Framework for Nutrition was a co-development, very much a team effort. And GTFN, the acronym you will hear many times today, became the acronym we use. So GTFN is both the name of the framework we developed together, and it is also the name of our coalition. So a couple of years ago, 𝗵𝗹𝗶𝗀𝗇 Health Research Institute, University of Toronto, and Nutrition International led an effort to operationalize the GTFN framework. And together, they led the participatory process to develop the tools to help practitioners like you and I to have the tools to practically apply GTFN principles in our day-to-day work. Thank you very much. And can we have the next slide, please? So we appreciate your interest in our work, and hopefully in the next hour when we're together in this webinar, you will gain a better understanding of why gender transformative work matters and the difference it can make in addressing malnutrition and health inequities. We hope you will gain practical insight to how to apply the Gender Transformative Framework for Nutrition and the systems-based thinking tool to strengthen the program design and implementation. This is also a forum where we get to learn from our peers' experiences and reflections on what works, what's challenging, and what's next for advancing gender transformative action in global health and nutrition. Thank you very much. And please, next slide. So today we have an ambitious agenda. After our opening remarks, Alison Riddle from 𝗵𝗹𝗶𝗀𝗇 Health Research Institute will give us an overview of the Gender Transformative Framework for Nutrition. So if you're not familiar with the framework yet, don't worry, she will walk us through. And Alison will also introduce us to the systems-based thinking tools that we will talk about today. Then we will move into case presentations to show you how the GTFN can be applied in practical terms in real-life examples. First, we will have Maya Israelov-Smith from CARE Canada to share an example focusing on South Sudan. Then Sarah Anderson from Save the Children Canada will walk you through a case study in Yemen. Then we'll have a short Q&A session, so you get to ask questions about these presentations. And we're thankful that 𝗃𝗴𝗃 Sterling from University of Toronto will be moderating that Q&A. Then we move into a panel discussion, and we'll have three panelists. We'll have 𝗃𝗏𝗄 Makuria from Nutrition International, Ethiopia. We'll have Finian Ali, who represents the Sun Civil Society Youth Network in Nigeria. And Maya will also join us in the panel discussion. And Megan Wollenberg from ACF Canada will be our moderator. After that, Jenna Hickey from University of Toronto will share what do we see as the way forward for the GTFN tools before we move into the closing segment. Next slide, please. So we have quite a lineup of presenters today, and you are welcome to go and look at our bios, get to know us a little bit on the GNC events website. We can pop the link in the chat in a little bit later. One colleague who is not on this slide and I want to highlight is Abena Thomas-Wambui. She is the former gender advisor for the Sun Secretariat and also a very long time co-worker at World Vision. And thanks to Abena, who reached out to the GNC, that we are able to partner today to host this webinar. So thank you, Abena, and thank you, GNC, for having us. And without further ado, I would love to introduce our first two speakers who will open us in the webinar today. Next slide, please. First up, we are so delighted to have the Chief Executive Officer of Action Against Hunger Canada, Onome Ako, to give our opening remarks. Onome also serves as the chair of the board of directors for the Canadian Partnership for Women and Children's Health. And she is named to the 2020 Canadian Women in Global Health list. And she's recognized as one of Canada's most powerful women, top 100 in 2021. More recently, in 2023, Onome received the Royal Bank Canada Canadian Women Entrepreneur Award for her impact in social change. She is also a co-author of Embracing Ambition, a leadership collaborative amplifying women's voices in leadership. Onome has led initiatives in over 20 countries, and I know her to be an inspiring leader, and she continues to work tirelessly to empower and uplift the lives of women, children, girls, and many around the world. Over to you, Onome.
Perfect. Thank you. Can you hear me?
Nice and clear. Thank you.
Okay, perfect. Good morning, everyone. Thank you so much for that intro. And thank you to everyone for being here today. I think I saw a hello from Abena. So Abena, welcome. It's great to have you here today as well. I think I wanted to start by saying and recognizing everyone's presence today at a time when everyone is super busy and super preoccupied. It reflects that the importance that you place on advancing gender equality in the nutrition practice. And I think we can all agree in this virtual room that gender equality is essential to good nutrition. The challenge we have is translating this into day-to-day programming, decisions, measurements, and advocacy. And that's exactly why the Gender Transformative Framework for Nutrition and the multi-system tools we're launching today set out to do, to move us from principle to operational reality. Action Against Hunger Canada has been part of the GTFN coalition from the very start, working alongside partners, which Miriam already mentioned, including World Vision, CARE, Nutrition International, Save the Children, Royal Health Research Institute, and Health Bridge. Through CAN-Watch's collab, and in partnership with the University of Toronto, we've collectively created these tools to bridge disciplines, connect systems, and make gender equality truly operational in nutrition programming. This work couldn't come at a more critical time. Earlier this year, Statistics Canada reported that over 25% of people in Canadian provinces are experiencing some form of food insecurity. And with no, sorry, I'm so sorry. There you go. Can you see me now? Okay.
No, we still can't see you, 𝗂𝗍.
I think the host is going to need to do that because it's disabled from the hosts. So I will just go on, and if that's enabled by the host, then it will come on. Okay, perfect. I think it's come on now.
Yes,
so
we
this
can see you. Thank you.
Perfect. So I will do a quick recap of Statistics Canada reports that 25% of people in Canadian provinces are experiencing some form of food insecurity. And with no surprise, that, women, children, and marginalized populations are mostly disproportionately affected. This is a stark reminder for all of us that gender nutrition inequalities are not just distant global issues, but also a concrete reality for millions of Canadians. In parallel, within the sector, we recognize the need to evolve in response to global changes in policy and funding, to embrace multi-system approaches, food security needs, and localized approaches to mitigate the intersecting causes of hunger. Canada has a long legacy as a champion of gender equality. And this legacy is reflected in Canada's foreign policy priorities, which include promoting gender equality as a core value, and in the Feminist International Assistance Policy, which most of us know, and which recognizes the positive ripple effects of investment in health nutrition. By providing the funding to CAN-WATCH's CoLab to develop the GTFN multi-sector system tools, Canada continues to demonstrate leadership in this space, making gender transformative approaches accessible for practitioners and translating the FIAP's policy commitments into tangible guidance for concrete, evidence-based action. And so today, as we explore the tools and case studies, I would like to invite you to share your own technical insights to strengthen the effectiveness of these tools at the local level, which is super, super critical. Your inputs will help us all understand how to translate gender commitments into meaningful action across diverse contexts. Your leadership as well and your commitment to technical excellence are essential to this work. And I'm super grateful for everyone for your commitment. And with that, I will hand it over to Dan Ivan of World Vision International.
Thank you so much, 𝗂𝗍. So next up, we have the Global Director for Health and Nutrition, Dan Irvin, for World Vision International. Dan, in addition to overseeing World Vision's health and nutrition portfolio worldwide, he has also served on numerous steering committees, including the Child Nutrition Fund, and chairing the Ebola vaccine deployment, acceptance, and compliance steering committee. Dan has been an active member of the Wasting Advocacy Coalition since its inception. And he's also a member of the Wasting Action Review Panel Task Force. And more than that, Dan has been a steadfast supporter of the Gender Transformative Framework of Nutrition since its inception. So thank you for being with us, Dan. Over to you.
Thank you, Miriam. Hello, everybody. Wonderful to see you. I'd like to first thank all of the numerous participants who have organized our discussion today, to the GTFN partners, the SBT pioneers, CAN-WATCH, and the Government of Canada as well. And thanks also to 𝗂𝗍 for setting the stage. 2019, I had the privilege of providing similar introductory comments at the Women Deliver conference in Vancouver, where we first launched the GTFN idea. Back then, we knew that our community needed to move beyond the simple moral argument that women and girls disproportionately bear the global burden of malnutrition, and also treating them as passive beneficiaries of aid will not change that fact. The GTFN partners set out to map an evidence base indicating nutrition and gender equity intersection, ultimately leading to the important construct of the 3 empowerment circles, looking at agency, resource, and opportunity, and the 7 systems domains. And I'd like to emphasize that this framework is not just conceptual, but based on extensive evidence review. Today, it has become an important global good. I'm sure that my friend 𝗵𝗺𝗻𝗵𝗀, who World Vision seconded to the Scaling Up Nutrition movement as their first nutrition gender advisor, would testify to the power of the GTFN in her engagements over the last 2 years. And yet, like many other excellent conceptual frameworks, the GTFN is not intuitively employed in policy and program planning. We've all felt the need for some operational tools with which to engage these processes constructively and concretely. This need has driven the development of the systems-based thinking tool we are celebrating today, a very concrete step forward in our journey toward addressing the systemic drivers of inequity and the subsequent burden of malnutrition for women and girls that ensues around the world. The SBT translates the GTFN into a systems analytical format and introduces the causal loop diagram process to map complex cause and effect. Importantly, the SBT also suggests ways of prioritizing causal factors for address. That's super important in this type of assessment, and in particular in the most disadvantaged geographies where we can expect a critical mass of relevant issues. As I was preparing comments for our discussion today, I had to chuckle a bit, thinking about how complex nutrition is, how complex gender equity is, and then how crazy it is to put these 2 monsters together. I'm thankful that in our world we have so many dedicated and passionate people like all of you to keep us moving in a right direction in this nexus. And this leads to my final observation on where we stand today. We've been working on GTFN for 6 years. We've been grateful for the gender nutrition gap with FHI 360 and with the Stronger Foundation's Nourishing Equality platform. Also grateful for 𝗵𝗺𝗻𝗀's leadership at SUN and the blueprint for action she's left us, including follow-up on the gender-related commitments made at N4G earlier this year. At World Vision, we look forward to taking this advocacy up again at Women Deliver in Australia next year and invite you to join us. As we take the GTFN and the SBT forward, we cannot go it alone. Our gender nutrition goal is by definition a multi-stakeholder and diverse stakeholder pursuit. It requires coordination, collaboration, and concerted action. The nutrition community, as passionate and driven as it is not going to move this needle alone. So don't act alone. Don't implement this tool alone. That would be a fruitless exercise. The GTFN clearly gives us the message that gender nutrition requirements are multidisciplinary. And all of us here today do not have all of those disciplines' expertise. But we do have a shared passion to break intergenerational cycles of inequity and to empower literally half of the world's workforce to take control of their future, eliminating malnutrition in the process. Thank you all very much, and I'm looking forward to a wonderful discussion today.
Thank you so much, Dan. Now, I think the audience appetite is whet, and I think it's high time for us to hand over to Alison Riddle to unpack the GTFN as well as this systems-based thinking tool. Thank you. Alison?
Many thanks, Miriam. I just want to start by acknowledging the generous support of our donors and partners whose commitment has made this work possible, and their investment in advancing gender equality and improving health and nutrition outcomes has been instrumental in enabling this project. Next slide. So why this webinar and why now? I'm going to echo what those who have given opening remarks have said. I think we all realize that gender equality is central to achieving sustainable nutrition outcomes. And the Gender Transformative Framework for Nutrition, which was launched in 2020, was intended to guide that action and to move us from gender awareness to transformation. Since then, we've seen several organizations begin operationalizing the framework using practical tools and approaches. And our webinar today will highlight one tool in particular, but there is a series that we will give you reference to that are being applied in real contexts, including in humanitarian settings. Next slide, please. So the Gender Transformative Framework for Nutrition, the framework itself, positions nutrition as a multi-sectoral issue that spans several sectors, including health, WASH, education, food systems, social protection, and climate. And it places gender equality and the empowerment of women and girls at its core. The framework provides a conceptual and practical approach to transforming discriminatory norms, promoting equitable gender relations, and driving systemic change for inclusive nutrition outcomes. An advantage of the framework is its use of systems-based thinking, which is a way of looking at the big picture to understand how different parts of a system, like the people, the policies, and the environments, are connected and influence one another. The systems-based thinking process helps you to map the relationships, the causes and effects that shape nutrition outcomes so that programs can be designed to address the root causes rather than just the symptoms. Next slide, please. So today we're going to move from framework to practice, and through a global co-creation process with nutrition practitioners and policymakers. This was led by the University of Toronto, the Briere Health Research Institute, and Nutrition International on behalf of the coalition. We developed the systems-based thinking tool to define nutrition challenges and promote gender transformative responses. We'll see how the tool helps to bridge the gap between gender analysis and program design, especially in complex or crisis-affected contexts through selected case studies that my colleagues will present. But first, I want to give you a brief overview of the tool. Next slide, please. The tool guides you step by step to map the system behind a specific nutrition challenge. For example, anemia in out-of-school adolescent girls in Mombasa, Kenya. It starts by helping you to define the nutrition challenge you want to address and identify factors contributing to it using the GTFN framework. From there, it walks you through how to build a causal loop diagram, which is a visual map showing how these factors are connected and influence each other. And there's an example on the slide for you to see it. The diagram, most importantly, allows you to spot leverage points. These are places where a small, well-targeted change can lead to bigger, lasting improvements across the system. So this approach goes beyond treating symptoms to uncover and address the underlying causes of a nutrition challenge, helping you to design solutions that create meaningful, system-wide change rather than short-term fixes. So now let's actually see what it looks like to use the framework and the systems-based thinking tool in action. I'm going to turn it over to Maya Israeloff-Smith, the Gender Equality and Inclusion Technical Specialist at CARE Canada, to share CARE's experience using the GTFN framework and the systems-based thinking tool to design a nutrition project in South Sudan. Thank you.
Thank you so much, Allison, and to everyone who spoke so far. So my name is Maya. I'm going to walk us through how we actually use this system-based thinking tool in practice, specifically when we designed a project in South Sudan back in 2024. Next slide, please. So just to walk you through this project, 𝗵𝗃3 was a continuation from a project called 𝗵𝗃2. And essentially the purpose of this project was to reduce food insecurity, and it used gender equality as a way of tackling this very head on. So the focus was really on reducing gender inequalities as a way of advancing food security in South Sudan. So we worked on improving women and girls' participation in managing threats to food security. We also had a very agricultural, specifically focused intervention where we focused on agricultural practices, income generation, and value chains. And we also had a pillar that focused on women's participation in leadership and safety. Next slide, please. So the tool itself, the systems-based thinking tool, as Allison explained, has the causal loop diagram, but it also has a tool that allows you to map different variables when you're doing an assessment. So we came to this point, we want to design a new phase of the project. We wanted to conduct a needs assessment. We wanted to talk to the participants of the current phase of the project to understand what are the needs, what are the gaps, where should we focus for this next phase, and where do we start? So we started with the analytical dimensions that come from the Gender Transformative Framework for Nutrition. And within our specific context, these are how the dimensions came to be important. So agency is the first one, and this really focused on women and girls' decision-making power over their diet, their income, their sexual and reproductive health and rights, their confidence and their motivation to take on leadership roles in their community and at the regional level, to access loans, and also collective agency through women and youth group participation. The second dimension is resources. So how are people able to access productive assets like land, credit, markets, technology? How are women able to control income, to balance their workload, their unpaid care burden, and their time availability to invest in businesses and agriculture? And how are they able to access essential services like sexual and reproductive health, water, sanitation and hygiene, and nutrition information and services? So the final dimension is opportunity structure. So this relates a lot to the deeply ingrained cultural norms. We know that cultural norms have a huge impact on how food is distributed within households and communities. It perpetuates harmful practices like gender-based violence, and it influences decision-making, and it indicates that decision-making is often very gendered, especially in a context like South Sudan. There's also the institutional aspects of the structure's pillar, so supporting women's leadership, rights, nutrition-sensitive agriculture through policy and laws, and social protection systems that can either promote or hinder equality. Next slide, please. So now getting a bit deeper into the assessment itself. So now that we understand the analytical pillars, these are the domains of analysis that we used. So these actually come directly from the Gender Transformative Framework for Nutrition, if you can remember the diagram that Allison presented. So firstly, we have equitable food systems. So in our case, this meant the gendered access and control over food production and consumption. Next, we have gender and adolescent responsive health and nutrition systems. So this has to do with accessing services that are age and gender sensitive for nutrition and sexual and reproductive health. Equitable education. So here we're talking about literacy, nutrition knowledge, girls' education. Economic inclusion. So this has to do with women's access to income, assets, and credit. Safe and equitable water and sanitation and hygiene. So this is addressing women's specific water, sanitation, and hygiene needs and how this impacts their safety and ability to access services like education. Social protection, so relating really to how women and girls are protected during shocks and what support systems are available for them. And finally, environmental and political resilience. So what is the role of women in adapting to climate, conflict, and political stressors? Next slide, please. So this was the basis of our assessment, and that was our framework going into the needs assessment. So what did we actually find? So we talked to about 300 people in 9 counties across 6 states. Participants included adult women and men, youth, small-scale farmers, religious and traditional leaders, as well as key informants from banks, microfinance institutions, private sector stakeholders, and disability inclusion-focused organizations. So here's the key findings from each domain. Firstly, under equitable food systems, we found that food insecurity was greatly worsened by natural and climate disasters like floods and droughts, and that there was a lack of inputs. We also found that female-headed households and households headed by people with disabilities were disproportionately impacted by food insecurity, and that food distribution was often unequal and usually prioritized men first or first wives in the case of polygamous households. Secondly, under gender and adolescent responsive health and nutrition, there was generally low service quality and low accessibility. Factors like sexual and gender-based violence, early and forced child marriage, alcoholism, and customary laws reduced people's well-being. And stigma and safety really limited the access to services that were not adapted for people with disabilities and girls. In terms of equitable education, we found that girls and people with disabilities faced very important barriers to accessing education, mainly due to harmful norms. Child early and forced marriage in the case of girls was a huge barrier to accessing education, as well as cost implications, poor infrastructure, and male-led decision-making on who attends school. In economic inclusion, women, youth, and people with disabilities generally lacked the ability to access credit, business capital, and men usually controlled decisions around income and taking out loans. Safe and equitable water, sanitation, and hygiene. So there were long water collection times that limited women's productivity. Women were typically more involved in collecting water, which also had safety implications for them. And poor menstrual hygiene affected girls' attendance at schools and participation in other activities. Social protection. So there were generally weak safety nets for women, girls, people with disabilities, and the elderly, and communities were really in need of targeted support in this area. And finally, environmental and political resilience. So flooding, drought, insecurity really disrupted livelihoods generally, displacement, and conflict. All of these factors really limited women and girls' ability to participate and their mobility as well. So we can see how all of these different factors ultimately had a huge impact on our ability to achieve nutrition outcomes in this project. And this is where we knew we needed to focus for the 3rd phase. Next slide, please. So this is just a highlight of the key recommendations from the assessment. So we decided that it was important for us to emphasize financial inclusion, to establish and strengthen local microfinance institutions and improve the loan access for women, youth, and people with disabilities. Agriculture and markets, so continuing to provide tools, improved inputs, climate-resistant seeds, and linking farmers to larger markets, especially using a gender and inclusion responsive approach to make sure that the markets that they're accessing are well adapted to their needs. Skills and education, so there was a huge need for vocational training, including literacy for women, youth, and people with disabilities, as well as gender equality and inclusion responsive value chain training, as we saw that women and girls tend to be focused on different value chains than men and boys. Social inclusion, so generally raising awareness on gender equality and inclusion was needed, and challenging harmful social norms that ultimately hinder nutrition outcomes. And finally, just more broadly, the design implications for this project were really to reduce social, financial, and infrastructural barriers and to empower structurally excluded groups. So that's it for me. And I will hand over to Sarah Anderson from Save the Children, Canada.
Thanks, Maya. Hi, everybody. Thanks so much. So thanks, Maya, for walking through the tools. What I'm going to present today is actually some of our work around not using the tools, but using the framework itself to design and implement nutrition programming in a humanitarian context and response. So as you can see there on the slide, I'm talking about two examples that we have recently from the 𝗏𝗏 government in Yemen. So first from 2021 to 2022. Then we had additional funding from 2023 to 2024. We do have funding for 2025 and 2026, but I'm not covering that right now. So the projects, what did it focus on? It focused on reducing acute malnutrition rates, particularly among women and girls and children under 5, who are disproportionately affected due to gender norms, talking about women and girls, affected due to gender norms around who eats last and least during times of food insecurity, inequitable sharing of household chores and responsibilities, and the lack of access to healthcare. With these two projects, or response, if we want to call it that in humanitarian settings, they were not overall gender transformative projects. So meaning that if you think of a logic model at the ultimate outcome level, these projects were not focused on gender equality at the highest level or women and girls' rights. They were still focused on that life-saving intervention and reducing suffering in addition, like as it relates to malnutrition. And we had a component on water, sanitation, and hygiene and protection as well. But it did have gender transformative approaches. So think more at the outputs and activity level. So that's what I want to share with you today is how did the team do this and what were the results of that within a humanitarian response? Next slide, please. So some of the interventions that were included were father-to-father support groups where fathers, in addition to mothers, learned about infant, newborn, and young child feeding interventions and practices and the nutritional needs of their pregnant and lactating wives. So the men also learned about the role that they play within this. So as we know, it can be more common in development programming to use this approach that we engage men and boys in this. But we also know in humanitarian settings, given the urgency, we often focus on primary caregivers, which is a huge missed opportunity in terms of integrating that gender transformative aspect to our interventions. So by doing this, what did we see? We saw more equitable decision-making and therefore increased agency of women at the household level and men's overall engagement. And I'll get more into the results in a moment. The project also included a women's economic empowerment component, which had women's groups who were trained and supported to make reusable menstrual pads for their own use, so therefore meeting their need for menstrual hygiene management under the WASH component, but also for income generation. So this created a greater access to resources. So thinking back to the slide where Allison presented around agency and resources. And next, when we look at opportunity structure, the project team also worked with local authorities to introduce a women's quota for the WASH committees, a space that women are often left out of. This quota, along with the men's engagement activities, fostered greater access to an opportunity structure that helped foster women's empowerment to exercise their agency and decision-making at the community level. So now we see agency not only in their household, but at the community level as well, in accessing and participating in this opportunity structure. Next slide, please. These two projects not only show how to apply the GTFN in humanitarian context, but they also prove that gender transformative interventions are indeed possible in humanitarian programming. This is often the argument we get and the pushback we get is that humanitarian programs too quick, life-saving interventions, we can't incorporate gender equality. And I'm here to tell you from these projects, you absolutely can. And here are some examples how. So the slide I have there, I won't spend too much time on it. I just want to share a few examples with you so you can take a look around how you can move from more of a gender sensitive or responsive intervention to more gender transformative ones within a humanitarian setting. I'll give you a sec just to take a look. Okay, next slide, please. So earlier this year, we at Save the Children partnered with Allison and her team at the Briere Health Research Institute, and we launched a case study based on these two projects, and we can share that with you after today's event. So we really wanted to take a look, the framework in action. How can we measure what we did and what we achieved against the framework? Which you can use the framework to design the project, but we wanted to use it at the end as well as that analytical framework. So what did we see here? What were the successes? So as I mentioned, we had the women's quota for the WASH committee. So this was set at 30%. Of course, it's not 50%, it's not perfect, but it was a step forward, and it was a huge step forward in terms of shifting the needle here. And why is this important? I want to read to you a quote from a woman who's an IDP who participated in our gender equality assessment, so you can see just why this is important. She said, "When they ask the community what we need, they ask the men. But the men don't cook. The men don't fetch water. They don't know how dangerous it is for us. We're the ones who walk with fear, but we have no voice." So this is particularly why we wanted to ensure working with government officials to set up that there was at least a 30% quota minimum for women to participate in these WASH committees, to be able to have a voice and also to be able to be part of the decision-making as well. So we know that the number alone is not enough, right? We also focused on their meaningful participation, equitable decision-making within these committees as well. This also meant that we had to work with greater community acceptance for the women's participation in these committees. So this meant not just among the men in the committees themselves, but their family members, government officials, like I said, and the broader community. And this created greater awareness and acceptance for women's leadership roles within communities. Women reported increased confidence, but also that the communities had more confidence in them as well, resulting from hygiene and WASH management skills development. We also saw a shift in family communication and parenting, resulting from the father's participation in the father-to-father groups. And the girls reported, so not only did we see more participation of the fathers in the nutritional needs of their children and their wives, but we also saw improved, more open, engaged, deeper conversations and communication with their children, and girls reporting that their fathers were more willing to listen to them as well, which was a very positive outcome we weren't striving for, but we're still able to achieve. Significant changes in attitudes regarding sexual and gender-based violence, including child early and forced marriage, the harms, the risks, but also around child discipline and support for girls' education. So again, this is a humanitarian project, but we were able to integrate 𝗂𝗄𝐸 and other messaging around this within the programming. We also saw significant progress in tailoring nutrition services to the needs of women and girls, so counseling and outreach mechanisms for greater access, convenience, but also improving ethical standards. As mentioned earlier, we also saw women's increased economic empowerment and decision-making while also meeting their menstrual hygiene management needs that are more sustainable and environmentally friendly, focusing on the reusable pads. So as you can see, focusing on agency, resources, and opportunity structures is indeed possible within humanitarian nutrition programming, particularly in protracted and ongoing crises like we have had in Yemen. So I'll stop there, but for any specific questions about the implementation of the project or the response, my wonderful colleague Mohammed is online and he's in the chat if you have any questions for him around how did they do this, like what were the specifics of the interventions. Thanks, and I think it's going back to Miriam.
Thanks, Sarah. Now I'm going to invite Victoria to moderate our Q&A. Victoria, over to you.
Thank you so much, Miriam, and thank you, Maya and Sarah, for these fantastic presentations and case studies from South Sudan and Yemen. Perhaps to get the ball rolling, Maya, perhaps given needs assessment being a critical piece of a project lifecycle, perhaps you may start us off by elaborating further on the process of incorporating the GTFN domains into the needs assessment, and if there's any key learnings that can be shared.
Yeah, thanks so much, Victoria, for the question. So I think we've seen in the framework how when you really look at the framework and you look at how integrated all of the domains are with nutrition outcomes, it's pretty clear that even if you try to prioritize and say, oh, well, let's just look at a couple of the domains and we'll leave the other ones out, at the end of the day, it never ends up working. So it was a pretty easy decision for us to include all of the domains in our assessment. I think one learning that we definitely had that inspired me for other projects, including humanitarian projects, is how this domain of environmental and political instability can really be zoomed in on for when we're doing things like a conflict analysis. It's pretty clear from the existing tools in conflict analyses that they're not always the most gender responsive. Sometimes this aspect of gender and gender transformation might be overlooked in conflict analyses. So I think that this was a really key takeaway for us when we look at what is the role of women and girls and structurally excluded groups in managing conflict. In the case of South Sudan, they have a huge role to play in peace building. Disproportionately, households become female-headed during times of conflict. And so all of these aspects were really important to take into consideration when we were thinking about building resilience in the project. And I think it could be applied really in any context where conflict analysis is needed during the needs assessment phase.
Excellent. Thank you so much, Maya. We have a question in the Q&A. A colleague is asking if perhaps Sarah, you could start us off. If you could please explain how you could use these tools to support the national government to come up with their specific GTFN planning, monitoring, and budgeting tools.
I think that, I can start. I think Allison might be better placed to answer this. I know that we as the GTFN Coalition have done some work before around encouraging governments to do this. But I think just given as a very quick answer before I hand it over to Allison, even just focusing what Maya was saying about the gender equality assessment and conflict assessment tool, to be able to use that to show data, to be able to use what everyone is saying around what is impacting them, to be able to use that to start these conversations before developing the tools for response. But Allison, do you want to take that one? Or do you want to add?
Yeah, no, I'd be happy to. It's a great question. And just something to highlight is one of the things that when we first started to develop practical tools, so I'm talking the work that we've done with the University of Toronto and Nutrition International, we used a co-design working group to really identify what the needs were in terms of tools to support implementation. And it came up with a pretty big list that we had to prioritize. And so we really focused on this design piece. And we'll introduce quickly as well, there's a piece on how to assess if an organization has the capacity to do gender transformative nutrition work. One of the pieces that we did not get to yet, because that project that was funding this work actually ended, is the question around monitoring, evaluation, and the corollary to that is budgeting. So I think there are definitely ways that the GTFN framework itself can be adapted to inform those pieces. We haven't developed the tools specifically for monitoring and evaluation, but we see a lot of opportunity there. And I know a lot of the colleagues from the coalition on the call today are working and thinking about these types of things. But the first piece, I think, with the systems-based thinking tool that can really help you start off is to identify what are those key interventions and where you want to intervene. And then we're certainly hoping to get to the point where we can also provide that practical guidance for monitoring, evaluation, and budgeting. Thank you.
Thank you so much, Allison. And maybe Maya, was there anything you'd like to add to the question?
Yeah, I think it's been pretty adequately covered. I would just also echo how valuable it is when we do invest in collecting data and having the power to actually have the evidence speak. I think that this is a really powerful tool for advocacy, especially at the national level.
Absolutely. Thank you. So we had a couple questions. So yes, we'll be sharing the links to the tools. The recording and the presentations will all be available. So thank you, Miriam, for just chiming in on that piece as well. We also had a question around the need for upcoming trainings on the subject and how it would support breaking the silence and overcoming the challenge. So I don't know, perhaps Allison, maybe I could relay that question over to you. Are you aware of any upcoming training opportunities on this matter?
This is something that's definitely on our radar and we've been discussing as a coalition. And so we are looking for upcoming opportunities and can certainly let the group know when we have something in place. And in the meantime, anybody who's interested in learning more should certainly reach out to us. My contact for the coalition is on the last of these slides, but you can certainly reach out to anyone who's here today, and we're happy to start those conversations with you.
Great to hear, Alison. And also just to echo 𝗂𝗵𝗍's opening remarks about experiences, please also reach out to share your experiences, and we'd love to hear from you. We also have another question here. So back to the needs assessment phases. So perhaps Maya, this is back over to you. How have you managed stakeholders or experienced conflicts either between stakeholders or in general in terms of many chefs in the kitchen, along with the aims of the project?
Yeah, that's a very good and relevant question. As you can imagine, of course, we're sitting in a room where we're looking at all these domains, and each person has their own technical expertise and perhaps also slight technical biases. And so I think what the framework helps to do is to show us how we're all working towards the same goal. So if we all know we're working towards the nutrition outcomes, and we understand how each of these different domains will ultimately impact nutrition outcomes, it really allows us to see that integration more rather than work in silos, which I think is something that's actually quite common in our sector, to be very siloed. And so it was actually a really amazing opportunity to be able to come together and see how we can kind of cross-pollinate our interventions. And it actually makes things more efficient, because sometimes you realize, oh, we're actually doubling up on our efforts in these two areas. Why don't we integrate them? So I think that that was really helpful. And then in terms of the perspective of collecting perspectives from community and having people in the community with different priorities, I do think that the work that we do in this project, specifically on shifting the social norms, also helps to ground us in really recognizing what are the underlying causes of some of these challenges. So if you take a social norm like the number of hours that women work in a day relative to men, that's just one example that will cut across essentially every single domain. And so when we get down to the depth of those social norms, it really helps us to understand how they cut across all of the different domains, and that it is really like an overarching theme that we're working on that will have an impact on every aspect of the project and on every domain.
Fantastic. Thank you, Maya. And perhaps just to wrap up this Q&A, maybe Sarah, I could hand you back over the floor and just speak and perhaps elaborate a little bit further on the multidisciplinary aspect of the humanitarian response in Yemen, given the nature of the protracted and ongoing crisis. Perhaps if you could elaborate a little bit more on how the GTFN not only supported guiding the humanitarian response, but also fed into also more development and resilient aspects of the interventions as well.
Sure. Thanks, Victoria. Great question. So I'm not sure if somebody said it before, but the reason we created the GTFN was that we wanted to think and do differently. So the GTFN is based off of a lot of research and extensive literature review. We wanted to make sure that when we designed the framework, it was based off of evidence, again, so we could think and do differently. That's why we applied it here in Yemen in a humanitarian programming. So like I said, oftentimes in humanitarian programming, we think there's no time, life-saving. We forget that human rights and gender equality are not an add-on. They're essential as the part of, as we're doing things, it needs to be integrated in what we do. Can we elevate it? Certainly. I know for decades we've been doing gender integration or mainstreaming. So what does the GTFN do? It helps us to think at that systemic systems level, like Victoria said, multi-sectoral, multi-integrated with, Maya had on her slide the different domains of intervention there with different outcome areas, if we want to call them that. So as you saw in the example I shared, not only did we look at working with health centers and community health workers and WASH committees, we also focused on thinking about GBV. We had a little bit of you saw that there was the improved outcome around even attitudes towards girls' education. So what we tried to do was we didn't just focus on the primary outcome of trying to reduce acute malnutrition, which is what the goal of the response was, but we did it through this multi-sectoral integrated way, which led us to see those great results and shifting the needle in terms of linking back to the GTFN and the inner circles around agency, resources, and opportunity structure. So like I said, if anybody's interested, we have the case study, we can share it. And if there's any specific questions, my colleague Mohammed is online for a few more minutes if anybody has any questions for him in the chat and the Q&A. Thanks, Victoria.
Thank you so much, Sarah. So we actually have a live question. So Mikuyu, we'll ask you to unmute, and perhaps I'm not sure who the question will be directed to, so please specify. Go ahead. I think we're just trying to unmute you. Miriam, is it possible to unmute Mikuyu?
I've asked him or her to unmute. I've given the permission.
Okay, okay.
But there doesn't seem to be any response. So there was another hand up a moment ago, but I don't see it up at the moment.
Indeed. Okay. Otherwise, please feel free to pose your question in the question and answer box, and then we can also refer to it later on. So perhaps with this, I can hand back the floor now over to Megan Wallenberg for the next part of the webinar. Thank you.
Excellent. Thank you so much, Victoria. And thank you everyone for your questions. And so everyone, we now welcome you to a brief panel session as an opportunity to hear from practitioners directly involved in these case studies. I'll be facilitating the panel of our esteemed guest. I'm Megan Brown Wallenberg from Action Against Hunger Canada, and I'd like you to welcome today 𝗵𝗵𝗀𝗻𝗃, Finian Ali, Maya Israeloff-Smith, all who have been working with unique experiences using the GTFN tools in their respective areas of work. So let's give them each a moment to introduce themselves and turn their cameras off if they can. 𝗵𝗵𝗀, would you like to start and then pass it on to Finian and Maya?
Yeah, thank you very much, Megan, and thank you very much for having me in this interesting webinar. This is 𝗵𝗵𝗀𝗃. I am working with Nutrition International Ethiopia Country Office. I am a Senior Program Officer for Adolescent and Women Health and Nutrition, and also I am a gender focal for the country office most programs, and I do have a kind of 20 years working experience as a public health professional here in Ethiopia. Thank you, Megan. Over to you.
Thanks so much, 𝗵𝗵𝗀𝗃. I'll pass it over to Finian. Hi, Finian. Are you able to introduce yourself? I'll give him a moment here. Maya, would you like to introduce yourself while Finian gets access to his computer?
Sure. Yeah, I feel like people have already heard from me a lot, but my name is Maya. I work for CARE Canada as a gender equality and inclusion specialist, but I'm also a nutritionist. I have a background in global health. So before working at CARE, I worked for different organizations as a nutrition technical specialist, like Action Against Hunger, UNICEF, mainly in field offices in East, Central, and West Africa.
Excellent. Thank you so much, Maya. And Finian, are you able to join us?
Hi, everyone. Good afternoon from Nigeria. My name is Finian Ali, and I'm the youth coordinator for the Scaling Up Nutrition Civil Society Youth Network in Nigeria. It's a pleasure to be here. I'm particularly interested in working with young people and pushing through advocacies and, of course, community dialogues to understand root causes of malnutrition and then work with the constituency to drive actions. Thank you.
Excellent. Thank you so much, Finian, and welcome. My first question is for you, Finian. Before we get started, I also want to add for our listeners that if you have any questions for the panelists, please put them in the chat and we'll address them after with Victoria's support there. Okay, so for Finian, the first question we have is, what were the biggest challenges you faced when using or adapting the SBT tool in your context? And how did your team overcome these challenges? And before you answer, quickly share which case study you're part of.
Great. Thank you so much. That's a very brilliant question. I would like to begin this way, that from my experience working with young people and marginalized community through our Sun Civil Society Youth Network in Nigeria, I've seen, firsthand that malnutrition is not just about lack of food. Oftentimes it's about power. It's about access, it's about opportunity, and which is why the GTFN is quite very critical. In many of our community nutrition dialogues that we've had here in the country, we've seen young people and adolescent girls, share how deeply gender norms affect their nutrition outcomes. A good instance is the case of 𝗊𝗶𝗀𝗄𝐻 state, where we have a teenager who shared how, she became vulnerable to sexual abuse, and that also have impacted on how her nutrition outcome came to be, And I just wanted to emphasize that this framework truly, really matters. And ultimately, if we have to address malnutrition, we really have to address gender inequality. Let's see it like we have to train the systems, the symptoms. We also need to treat the cure. So in terms of challenges that we experience, one of the biggest challenges that we experience, particularly because young people and appreciating the strategy, it looked quite technical, in the beginning. It seemed a little bit complex because young people are much more familiar with storytelling and maybe sharing lived experiences of what they've passed through or what they are passing through. So what we now had to do was to kind of develop a simplified process, and we made it more participatory. So when we come to nutrition dialogue, for example, instead of focusing on trying to develop the formal causal loop diagrams, we instead do a kind of community mapping exercise. We ask the young people, we ask the mothers, the teenagers, we ask them what are the root causes? What were the kind of the nutrition challenges that they face? What were the root causes? And those things gave us insight into the system-based thinking. We begin to visualize and connect the loops. So another challenge, is about when we have these conversations, it's difficult for young people to connect to the dot around, the time and trust. Sometimes, system-based thinking requires that you give it a lot of time to reflect, hold conversations and come up with why things are and what caused these things to be. So it was a challenge, and what we had to do is to just reduce the timing into informal group meetings. So we needed to do nutrition dialogue. We reduced it to about 8 to 10 persons. So we did about 57 dialogues in Nigeria, and we have just about 8 to 10 young people in these dialogues. You reduce the number of persons that we need to interact with. You also reduce the number of time that we have to engage, and it makes it easy for us to synthesize what the nutrition challenges are and the urgent actions that we needed to take. So I think one major takeaway from that is that, we try to make the tool more human instead of more technical, and I would like to pause there. Thank you.
Great, excellent answer. Thanks so much, Finian. You were instrumental in designing the SPT tool as a member of the co-design working group with the team here today. I also want to ask a question as a follow-up. Given this is in humanitarian context and time isn't always an option, what advice do you give to folks who'd want to use this tool in their own programming? And what were the positive outcomes, or you already mentioned challenges, so what were some of the positive outcomes from this work?
Yeah, thank you. In terms of advice, first, if you want to adopt the system-based thinking in line with the GTFN framework, I'll really advise that there should be inclusive leadership. That's first. And for example, youth leadership is critical. Young people oftentimes are the front line of humanitarian responses, and sometimes they are not usually part of the design or decision making. So if we can empower them to use this framework, like the GTFN, it can help us to ensure that programs reflect the dynamics within the families, within the different demography of young people, like people with disabilities, and even within the communities. And like I emphasized in my first remark, about ensuring that we make it more human. Sometimes the technicality around the document may prompt you to redesign a strategy that speaks to people in such a way that they can give you what you want. For example, you ask questions like, what caused this? What makes this to happen? What are the challenges that you face? Who are most affected by these challenges? How does social norms, how does the community structure, stereotypes within the society and cultures affect, you within the context of the nutrition challenges that you are facing? When you ask questions like this, it helps you to kind of precipitate feedback that will be very useful and help you to be able to use the tool very well. I would also want to emphasize that partnership is quite very key, and it bridges the technical and community expertise. For example, civil society groups, for me, I think they bring deep contextual understanding. So if you want to do this, you may also want to strengthen partnership, especially let's ensure that we have partnership around using the tools, around using the frameworks. When we bring partnership together, then we can both have both precision and authenticity. And I would also want to encourage that capacity has to be continually built, because most people may be used to traditional tools such as maybe problem tree and so on. So, but since this is new, there is need for us to continually engage, build capacity, not just one-off. Thank you.
Excellent. Thank you so much, Finian. That's very insightful. I'm going to pass this over to Maya as well. Maya, was there anything you'd want to add to this question? What were the biggest challenges you faced when using or adapting the SBT tool in your context?
Yeah, thanks so much, Finian, for the response. I think you've said a lot of the thoughts that I was thinking about. It is a highly technical tool, so it does take a bit of time for people to get used to it. This is why we chose to take a chunk of it only. So we didn't actually have time to go through the causal loop process in depth. It was a very quick turnaround, designing a project. We don't have much time. All of a sudden, we're in South Sudan. So how can we do this in a way that's efficient, where we're still able to integrate the domains? So that's why we just went with the approach of using the existing variables in the framework as a starting point to map out the challenges. I will also echo the importance that we placed on including structurally excluded groups. So Finian's mentioning youth. South Sudan's population is about 70% youth. So it seems absurd that youth wouldn't be at the forefront of decision making when it comes to designing a project, because they're the ones that will be largely engaging with the project. And so this was definitely also something that was really important to us. And it's an area where we see that the challenges are very different. And this is why the intersectionality and looking at the different identity factors of different groups is so important to consider, because it's not just about women and men. There's so many different factors. So I think that having that nuance in the way that we approached it was challenging, but it was something that we were able to prioritize based on the needs expressed by community members, by existing participants in the first phase of the project, and just by stakeholders in the workshop, so that even though we didn't get to do the full causal loop, we did spend a lot of time to make sure that our analysis included those marginalized groups that might not always have a voice in the design phase of a project. And I think that this is kind of built into the framework already, which I found to be very useful as a starting point. And it just proves that you can use the tool very quickly, because we really did not have a lot of time and we still managed to use it, and we still managed to integrate it in the design.
That's great. Yeah, thanks so much, Maya. Okay, that's great answers to the first question. We have one more question here before we'll go to the Q&A chat. This one's for 𝗵𝗡𝗂. 𝗵𝗡𝗂, you were vital in this role for piloting these tools in Ethiopia with Nutrition International, and tested the tool and provided valuable insight on its refinement. So the question for you today is, the tools are detailed and data rich. For organizations with limited bandwidth, what would you consider the essential elements or entry points for getting started?
Yeah, thank you, Megan. I mean, this is a very interesting question. I mean, and I would like to echo what Finan and Maya already mentioned about the technical in-depth of the both tools. I mean, both especially for system-based thinking tool is very technical in-depth. So I mean, we need to start as a starting point. What already mentioned by Alison, we need to work on the first tool, that is a capacity assessment tool. That capacity assessment tool will provide us, I mean, details about how the organization is capable of performing or capable of implementing gender transformative nutrition programming. That is something which we need to consider as a starting point. Like for instance, in my organization, Nutrition International, I mean, where gender mainstreaming is a very core organizational value, and also we do have the evidence for the organizational culture and the leadership that gave us the chance to come up and pre-test both tools immediately. So what I advise for the organization with small boundaries, I mean, they need to focus on the first tool, that is having or achieving the capacity, the organizational capacity to conduct the system-based tool. So achieving gender transformative performance across the most building blocks, I mean, that are nearly about 6 building blocks are included in system-based in capacity assessment tool, or when we focus to improve our organizational performance based on the criteria included in those 6 building blocks. I mean, we will get the technical capacity, the partnership, the leadership, the resource, as well as the measurement capacity that will give us the likelihood of the system-based thinking informed GTFN intervention to be designed well, as well as to be implemented and also to sustained. The other key thing is which I learned today, I mean, from the presentation from Maya, as well as the presentation from Alison. I mean, we need to start defining our problem with intersectionality lens. I mean, that will give us to narrow our focus, and also that will give us to prioritize the most vulnerable and hard to reach groups. Addressing the structural gendered and social norms affecting that groups will streamline entry points, as well as improve outcomes for other population intersects with relatively fewer barriers. That is something which I want to say, Megan. Thank you. Over to you.
Great. Thank you so much, 𝗵𝗡𝗂. Very insightful input about your experience in Ethiopia with piloting this project. Thank you so much. Are there any questions that we can take from the chat?
At the moment, I think everyone is digesting the great insights from our panelists. So perhaps maybe I could ask Finian and Maya perhaps to elaborate a little bit more. 𝗵𝗡𝗂, you were mentioning intersectionality, and perhaps you could elaborate based on your experiences and contexts, how did the tool support intersectionality considerations into the design and rollout of programming? Finian, do you want to start us off?
Yes, yes. Thank you so much for that question. And I would like to give a practical example from one of the nutrition dialogue that we conducted in Nasarawa State. So before we did the dialogue, we, as a team, myself and my colleagues, the team leads, we had to think through what we wanted to achieve. The key objective of the dialogue was for us to identify the nutrition challenges that young adolescent girls, of course, face, and then to be able to, from that, precipitate advocacy issues or policy issues. The tool was quite very helpful because it gave us a platform for us to begin to appreciate when we engage on the root causes, we begin to appreciate different contexts, including disabilities as a variable that impacts nutrition. And we also saw reflect how social stereotypes and cultural norms and dietary needs also inform malnutrition within the demographics of young people. And then when we decided to now go further, to now look at how those nutrition challenges, those root causes what kind of policy issue can we craft from the root causes so that we can begin to have some advocacy engagement to influence those issues. That was when, the loop kind of started having some positive feel and positive addition as to, oh, this impacts this. And it was quite very easy for us to be able to do stakeholder mapping to map out the strategic policy actors that we need to engage so that we can, achieve the advocacy issue we're pushing on. So I just want to highlight that the tool was quite very useful for us to connect the dots as to that malnutrition or nutrition is not just a standalone issue. So these are cross-cutting, there are cross-cutting factors that contributes to it. And it was also very useful for us in identifying how we engage, which was quite very critical to us because we know the problem, but we don't know who to meet, who to engage and how to engage. But with the tool, you have a feel of, if this can be resolved, then we're going to have a positive outcome. So I would like to highlight that as part of the feedback. Thank you.
Excellent. Thank you so much, Finian. We appreciate your time and your response there. So thank you, Finian, 𝗵𝗂𝗧, and Maya. Before we close the panel session, for those who are curious about the scope of the GTFN framework outside of programming, the GTFN has also been used as an analytical framework in a gender and nutrition meta-analysis conducted by Action Against Hunger Canada and the University of Toronto. This work was also showcased at this year's ICN conference in Paris. Victoria will leave a link in the chat for you to access and peruse this body of work if you're curious. And that concludes our panel. Thank you very much, 𝗵𝗂𝗧, Finian, and Maya for sharing your insights using the GTFN tools in your work. Very valuable information shared today. I'll now pass this over to Jenna Hickey from University of Toronto.
Hi, everyone. Thanks, Megan. Thanks, Finian, 𝗵𝗂𝗧, Maya, for your excellent contributions. My name is Jenna Hickey. I'm a research coordinator at the University of Toronto. So we wanted to show you a bit more of where to find the tools and resources that we've been referring to today. As of right now, the tools can be found on the projects page with our funder, so the Canadian Partnership for Women and Children's Health. The link is here. We'll also put it in the chat, and they will be made available elsewhere after this webinar. But there are 5 tools. As Allison alluded to, we spoke to the systems-based thinking tool today, and there are 4 others in this suite that has been developed, and I'll draw your attention to those in a couple of slides. So if we can move on. Let's talk about what it takes to move from awareness to real gender transformative action in nutrition. So the GTFN gives us a structure to do this, but the impact depends on how intentionally and purposefully we apply it. So we're going to want to start from the very beginning. Gender analysis and power mapping should be embedded at the very start of the project, not something that is addressed at the end as an exercise of completion. When equity is built into the design, it shapes who we reach, how we work, and ultimately what success for any nutrition project will look like. The second piece we'll want to look at is using systems-based thinking to continue to connect those dots. As we've mentioned throughout the webinar today, nutrition challenges don't exist in silos. They can often be addressed that way, but they don't exist that way. So they cut across health, agriculture, WASH, social protection, what have you. And SBT helps us to see where those biggest leverage points are and where gender norms are influencing the outcomes across all of these systems. Third, we'll also want to have the awareness that true transformation happens when the people closest to the problem are the ones shaping the solutions. So we worked with, as has been mentioned, a co-designer working group and an advisory committee on this project developing these tools. But partnering with women's groups, youth networks, and local CSOs means that tools and any subsequent programming that's conducted using the tools will be adapted, owned, and sustained in a local fashion. So that's kind of what we really are talking about when we discuss co-creation. We also need to document and share how gender transformative shifts will improve nutrition, resilience, and agency outcomes, because this evidence is going to be what's foundational to convincing funders and policymakers to scale what we're showing as something that works. And finally, we wanted to raise building capacity. So training teams, partners, and policymakers to use these tools and principles so that gender transformative thinking becomes a part of everyday policy and practice, not just, a one-off project that has an excellent, approach or case study conducted on it, but something that is used as a snowball starting point. If we can go to the next slide. So in terms of the framework becoming something tangible, we have some steps here for what you can do next. So as I mentioned, there are 5 tools available to you. We'll put them in the chat, but as a very first starting point, we can invite you to use the tools in your next program design, proposal, or framework that you're working through. So whether it is related to, unpacking nutrition challenges with the systems-based thinking tool, as we already discussed, or framing your policy asks using our advocacy guidance note, or seeing how ready your teams are to conduct this work with our assessing organizational capacity tool. There's lots of really good nuggets in these pieces, and we invite you to peruse offline. Secondly, here we are calling on everyone to advocate for gender transformative outcomes and systems change. So bringing this language into your policy dialogues, your donor conversations, and something even as simple as your coordination meetings. Pushing for systems level shifts and not just project outputs is a very important first step. Again, we want to emphasize the importance of investing in learning and evidence, so supporting research that really shows how gender transformative programming reshapes systems and power dynamics. And when we show those ripple effects, it will, in fact, help to drive both policy and investment to this cause. And lastly, we just wanted to leave you with a question. So something to keep coming back to is who benefits, who is excluded, and how can we shift that balance? So if every team and project applies this question consistently, we would hope to continue to see a real shift towards equity and accountability in this space. So thank you very much. I'm going to pass it back to Miriam to close us off with some key takeaways today.
Thank you so much, Jenna. Thank you, our panelists and all the presenters today, and for all the audience members who engaged actively and shared your questions and get us to think more deeply, and just really appreciate your thoughtful discussions. So today, you hear a lot of information, a lot of really exciting examples, and I hope you log off from the webinar convinced like us that transformation is indeed possible, even in crisis situation. And by applying gender transformative thinking, it helps us to uncover the root causes of vulnerability, and that actually helps to strengthen resilience in humanitarian response. So today, some of you are maybe just getting to know the Gender Transformative Framework for Nutrition, the GTFN tool itself. for the first time, we encourage you to continue to dive deeper when we share the resources. And remember that GTFN offers a structured approach that helps teams to integrate gender equality into nutrition, into WASH, into health interventions more systematically, rather than leaving it on the side as window dressing or an add-on. And we are fortunate that now, after 2 years of collaboration, we have these tools like the systems-based thinking tool and the other tools that Jenna had just highlighted to help us apply the GTFN principles and make it actionable. They will help us map how gender dynamics shape access to food, to care, and to services. And more importantly, identify those leverage points where our actions can drive change. Then, like Jenna, we encourage practitioners to take up the GTFN tools and try them and try applying them. And the more we use it, the more we can generate the data-driven decision-making evidence and also ensure the accountability in our actions in humanitarian action for women, men, girls, and boys. Last but not least, by embedding gender transformative approaches in humanitarian programs, it actually helped to lay the groundwork for sustainable recovery and more equitable nutrition systems going forward. Next slide, please. So I said in the beginning that we have an ambitious agenda today, and thank you for staying engaged and your active participation. We really thank everybody who participated, all the presenters, and all those who contributed to the development of these tools, and last but not least, the donors who supported this work. And we hope to stay in touch, and as Allison has offered, to be our contact point. So do reach out if you would like to stay connected. For the GTFN coalition, we are also taking a couple of months and gradually also transitioning into more of a community of practice format going into 2026. And more details will be shared. Now that you are registered in this webinar, we have your contact. And so stay tuned to hear more. And as we share out the resources that we presented today, including those that are introduced in the chat that you may not have a chance to take down, fear not, they will come with the follow-up sharing through the GNC. Again, thank you, GNC, for hosting us today. We just really appreciate your support throughout this process. Thank you again. And over to you, Miriam.
Great. My deep appreciation to the team that's worked so hard to bring this presentation to us today. The recording will be available, as you can see in the chat, on the website in a few days. Everyone who registered for this webinar will receive an email in 7 days from time with all the links, just to remind you. If you need any support for nutrition and emergencies, please reach out using these website addresses or the QR code. If you'd like to access the support that's available via the Global Nutrition Cluster website, just click on the Request Support button at the top. Multiple languages are available on the website and from our multilingual team. Once we close this webinar, a survey should pop up on your screen. We would greatly appreciate you taking a few moments to provide some feedback. So thank you to all of you for your time today, and I hope you have a good rest of the day wherever you are. Take care. Bye-bye.